Professor Anton raises the example of someone who had temporal lobe epilepsy having spiritual experiences. How once they might have been considered visionary, but today they are considered disturbed. What Professor Anton is getting at with this example and the rest of his video is the question, have we really settled the issue about the desirability of spiritual experiences simply by explaining them as brain events? Now, I would like to bracket the desirability aspect of the question and come at the question from a slightly different angle. I want to ask, have we really settled the issue about the healthiness of spiritual experiences simply by explaining them as brain events? Some are content to conclude that simply because there is no external causative source, like a God, to account for spiritual experiences, and spiritual experiences causatively speaking can be accounted for in brain event terms, that the experiences must therefore be pathological. Freud held such a view. Now, I think that assessment is naive, astonishingly perfunctory and a priori, and thoroughly non-empirical. Ask yourself, how do we assess the relative healthiness or unhealthiness of significant non-spiritual experiences in someone's life? The answer is simple. The way those experiences factor in the overall functioning in the person's life. If the experiences are advantageous to the person psychologically, then we consider them to be healthy. If the experiences seem to be deleterious to the person psychologically, then we consider them to be unhealthy. That is, we assess the relative health value of the experience on the effect that it has on the person psychologically. Why should we do any less with spiritual experiences? If the spiritual experience is advantageous to the person psychologically, then we should consider it healthy. If the experience is deleterious to the person psychologically, then we should consider it unhealthy. Granted, some interesting debates can be had about what criteria we would employ to distinguish between healthy and unhealthy psychological effects. But as long as we don't employ a question-begging criteria designed to reject the effects of spiritual experiences out of hand, then there is nothing in principle that would exclude spiritual experiences per se from the set of experiences that could result in advantageous psychological effects. This accounts for why we sometimes encounter spiritually minded people who seem to have a high degree of psychological health. Now notice, this approach does not deny that a person's spiritual experiences can be accounted for in causative terms as brain events. It simply says that one must look to how those spiritual experiences affect the overall functioning of a person's life to accurately assess their relative health or pathology. Thanks. That's it.